Good afternoon. This is All India Radio. I am Valsa Williams and with me is VC Pramod with the Midday News. The headlines. Centre exempts persons with disabilities and pregnant women employees from attending office till 31st May. Complete lockdown imposed in Rajasthan for 2 weeks to check the rising cases of COVID-19. Madhya Pradesh government to provide free treatment to poor COVID-19 patients. NHAI to set up oxygen plants in 15 districts of Bihar to meet the demand for medical oxygen in the state. More than 16 crore 49 lakh COVID-19 vaccines administered to people in the country so far. Over 3,31,000 people recover from COVID-19 in last 24 hours. 4,14,000 fresh cases of COVID-19 registered in the country. M.K. Stalin sworn in as the Chief Minister of Tamil Nadu. N. Rangaswamy sworn in as the Chief Minister of Puducherry. And Border Roads Organization celebrates 61st Raising Day today. As the number of COVID cases is on the rise, we appeal to our listeners to take all precautions and all those above 18 years of age to get vaccinated without any hesitation. The vaccination for persons between 18 and 44 years of age has begun at designated facilities. Stay safe and protected by following these 3 simple steps. Wear a face mask, maintain 2 gaz ki duri for social distancing, focus on hand and face hygiene. And now the news in detail. The centre has exempted persons with disabilities and pregnant women employees from attending its offices till the 31st of this month. In a series of steps taken by the Department of Personnel and Training towards ensuring preventive measures to contain the spread of COVID-19, the centre has now offered more relaxations. The employees who are exempted from attending the office physically would have to work from home. The latest order released by DOPT says that officers and staff should follow staggered timings to avoid overcrowding in offices and workplaces. All central government staff residing in containment zones have also been exempted from coming to offices till the containment zone is denotified. The order stated that all officials who attend office should strictly follow COVID-appropriate behavior, including wearing of mask, physical distancing, use of sanitizer and frequent hand washing with soap and water. The government today said that more than 16 crore 49 lakh people have been administered COVID-19 vaccines till now. Over 13 crore people have received the first dose and more than 3 crore people have received the second dose. The Health Ministry said in the last 24 hours more than 3,31,000 people were discharged. Until now, over 1 crore 76 lakh people have recovered from COVID-19. The recovery rate now stands at 81.95%. The country has reported 4,14,000 new COVID-19 cases and total number of cases has reached over 2 crore 14 lakh. In the last 24 hours, 3,915 deaths have been reported. The death toll in the country due to the pandemic has reached 2,34,083. The Health Ministry said currently there are over 36,45,000 active cases.
The centre has provided over 17 crore 35 lakh free vaccine doses to the states and union territories so far. Out of the total, nearly 16 crore 44 lakh doses have been used by them, which also includes slight wastage component. The Union Health Ministry has informed that the states and union territories still have more than 90 lakh thousand doses available with them to be administered. It added that in the next 3 days, over 10 lakh COVID vaccine doses will be given to the states and union territories to replenish their stocks and continue incessantly with the vaccination drive. The centre has rolled out an extended allocation plan for ensuring availability of vital antiviral drug remdesivir to the states and the union territories. Revising the earlier allocation plan, Union Chemicals and Fertilizers Minister Sadananda Gowda today issued the extended supply plan for distribution of remdesivir till the 16th of this month. The minister said the allocation plan will ensure smooth supply of the vital drug across the country and will help in alleviating any kind of difficulty faced by the COVID patients in its procurement. The minister affirmed that the incessant supply of the vital drug will help in fighting the pandemic with deeper resolve. Under the extended supply plan, the allocation for states like Delhi, Maharashtra, Chhattisgarh, Gujarat and Madhya Pradesh, among others, has been considerably enhanced.
Health Minister Dr. Harshvardhan visited RML Hospital in the national capital today to review preparedness for clinical management of COVID-19 cases. He inspected the high-flow medical oxygen plant that has been set up by DRDO in the hospital. Talking to media, the minister said with the help of this plant, 2.4 to 2.5 metric tons of oxygen will be generated. He added that the government is working to deal with the surge in COVID cases.
लगभग जो देश में 35 लाख के करीब एक्टिव केसेस हैं, उनकी संख्या के आधार पर साइंटिफिकली इसको अलॉट किया गया है। भारत सरकार प्रधानमंत्री नरेंद्र मोदी जी के नेतृत्व में हर तरह का हर संभव प्रयास कर रही है। कोविड की सेकेंड वेव से जुड़ी हुई जितनी भी चुनौतियां हैं, उनका सामना करने के लिए आप देख रहे हैं कि जैसे अभी केसेस भी ज्यादा अगर आ रहे हैं, तो उसी प्रकार से रिकवरी पिछले 24 घंटे में भी 3,31,000 से ज्यादा रिकवरीज हुई। इसके साथ साथ वैक्सीनेशन को भी बहुत बड़े पैमाने पर बल दिया जा रहा है। आज यहाँ मैंने वैक्सीनेशन सेंटर को भी विजिट किया है और करीब 16.5 करोड़ डोजेज जो है भारत के अंदर अब तक विभिन्न श्रेणी के प्रायोरिटी ग्रुप्स को जो है वो डिलीवर हो चुकी हैं।
He added that 200 beds have been increased in this hospital and out of these 22 are ICU beds. The minister said everyone should follow COVID-appropriate behavior.
हमारे प्रधानमंत्री जी भी कहते हैं कि कोविड एप्रोप्रिएट बिहेवियर को किसी कीमत पर कॉम्प्रोमाइज नहीं करना है। आपने वैक्सीन ले ली है तो भी आप अगर अपना मास्क ठीक से लगा के रखें, ये बहुत जरूरी है। 2 गज की दूरी बनाकर रखें, अपने हाथों को साबुन से बराबर धोते रहें और आवश्यकता नहीं है तो बाहर भीड़ में कहीं जाने की जरूरत नहीं है। भीड़ भड़क्के के फंक्शंस ऑर्गेनाइज करने की जरूरत नहीं है। ये बड़ी मूल बातें हैं। शायद कोविड के खिलाफ जंग में सबसे बड़ा हथियार जो कम से कम मैं समझ पाया हूं, वो ये मास्क और साथ में वैक्सीनेशन है।
Director of AIIMS, Dr. Randeep Guleria, has said that CT scans and biomarkers are being misused and they can be harmful as well. Briefing media in New Delhi, Dr. Guleria said there is no use of a CT scan if a person has mild COVID. He said data by the International Atomic Energy Agency for Radiation Protection in Medicine have shown an increased risk of cancer in later life due to frequent CT scans, especially if done at a young age. Dr. Guleria said one CT scan is equivalent to almost 300 to 400 chest X-rays and it increases the risk of getting cancer in young people.
सीटी कराने का कोई फायदा नहीं है, स्पेशली अगर आपको माइल्ड इलनेस है, आप होम आइसोलेशन पे हो और आपकी सैचुरेशन ठीक है और कोई ऐसे कोई लक्षण नहीं है। अगर हम एक सीटी कराते हैं, इट इज इक्विवेलेंट टू ऑलमोस्ट 300 टू 400 चेस्ट एक्सरेज। और ये भी डेटा है, IAEA का भी, इंटरनेशनल एटॉमिक एनर्जी कमीशन का भी डेटा है कि बार बार स्पेशली यंगर एज ग्रुप में सीटी कराने से रिस्क ऑफ कैंसर इन लेटर लाइफ इंक्रीजेस। तो आप अपने आप को नुकसान ही ज्यादा करा रहे हैं जब उसकी जरूरत नहीं है, क्योंकि आप अपने आप को रेडिएशन एक्सपोजर कर रहे हैं और उससे बाद में कैंसर होने का चांस बढ़ सकता है।
He said even in mild illness and according to a study, even in asymptomatic cases, a CT scan may show patches which go away on their own without treatment. The AIIMS director said clinical management guidelines are clear that people with mild illness need no medicine. He advised that based on limited data, one can take ivermectin or hydroxychloroquine, but there is no need to take too many medicines. Dr. Guleria said some patients take steroids in the early part of the disease, which increases viral replication, and taking high-dose steroids in mild cases may lead to severe viral pneumonia. He said steroids should be taken in moderate stage and as advised by doctors. Dr. Guleria said falling oxygen saturation, excessive fatigue are warning signs that indicate a COVID patient in home isolation needs hospitalization. He said in moderate illnesses, 3 types of treatment, oxygen therapy, steroids and anticoagulants are effective and are the main treatment strategy.
The Press Information Bureau in a tweet has asked people to visit cowin.gov.in for COVID vaccine registration. The move comes as a fake mobile application has been found doing the rounds for COVID vaccination. In a message, it is being claimed that all people above the age of 18 years can download this mobile application through the given link and register for vaccination. Senior Congress Party leader Rahul Gandhi has suggested to the centre to consider the option of lockdown in order to mitigate human suffering. In a letter written to Prime Minister Narendra Modi today, he said that the centre should take various stakeholders into confidence to put up a united fight against the ferocious pandemic. Sharing concerns about the economic impact of a lockdown, the Congress President, however, said that unimpeded march of the pandemic will result in many more tragic consequences than only economic distress. You are listening to the Midday News on All India Radio. A reminder of the headlines before we move on. Centre exempts persons with disabilities and pregnant women employees from attending office till 31st May. Complete lockdown imposed in Rajasthan for 2 weeks to check the rising cases of COVID-19. Madhya Pradesh government to provide free treatment to poor COVID-19 patients. NHAI to set up oxygen plants in 15 districts of Bihar to meet the demand of medical oxygen in the state. More than 16 crore 49 lakh COVID-19 vaccines administered to people in the country so far. Over 3 lakh 31,000 people recover from COVID-19 in the last 24 hours. 4 lakh 14,000 fresh cases of COVID-19 registered in the country. M.K. Stalin sworn in as the Chief Minister of Tamil Nadu. N. Rangaswamy sworn in as the Chief Minister of Puducherry. Border Roads Organization celebrates 61st Raising Day today. For quick news updates round the clock, follow us on Twitter at AIR News Alerts.
चलो मिलकर एक शुरुआत करें, चलो एक फैसला आज करें, मास्क नहीं तो टोकेंगे, कोरोना को रोकेंगे, चलो एक इरादा करते हैं, चलो कुछ वादा करते हैं, मास्क नहीं तो टोकेंगे, कोरोना को रोकेंगे.
Welcome back to the Midday News. Due to the surge in cases of COVID-19, the Rajasthan government has decided to impose a lockdown in the state for 2 weeks and has suspended weddings till the 31st of May. The lockdown will be effective from 5 a.m. on May the 10th to 5 a.m. on the 24th of May. The Home Department has issued the fresh guidelines last night. Only registered marriages attended by not more than 11 people will be allowed till the 31st of May. More from our correspondent.
The order banned marriage functions, DJs and marriage processions, marriage gardens, halls and hotels will be closed for marriage functions and owners will have to return the advance amount paid by the parties. Laborers working under Manrega have to follow social distancing norms. All places of worship will remain closed. People have been requested to conduct religious rituals at home. It has also been decided to allow only one attendant in case of emergency with a COVID patient admitted to a hospital, except for medical emergencies. No inter-district, inter-city, city to villages or villages to city travel will be allowed. All public transport including buses, tempos, tractors, jeep will be off the road. Jitendra Dwivedi, AIR News, Jaipur.
Gujarat has recorded 12,545 new cases of COVID-19 during the last 24 hours. According to the State Health Department, 13,021 patients recovered and were discharged from hospitals during the same period. More from our Ahmedabad correspondent.
New cases in Gujarat are constantly falling since last 1 week. Similarly, the number of patients recovered from COVID-19 is also increasing. This has reduced the crucial waiting period for getting ambulances and hospital beds significantly. Maximum 3,884 new cases of COVID-19 reported from Ahmedabad, while Surat recorded 1,039 new cases. 123 patients lost their lives during the last 24 hours. Meanwhile, 90 medical personnel of Indian Navy have joined DRDO-run Dhanvantari Hospital in Ahmedabad. These include anesthesiologists, physicians, medical officers, nursing staff and paramedical staff. With these additions, the total manpower provided to the hospital by the Navy has gone up to 169, which highlights the Indian Navy's commitment to the service of the nation. Yogesh Pandya, AIR News, Ahmedabad.
The Maharashtra government has decided to set up a pediatric task force. It will help the state to prepare for the third wave of coronavirus. Health Minister Rajesh Tope has said that as per recommendations of this task force, various facilities like beds, ventilators for children, SNCU beds, etc. will be set up. Maharashtra has received 52,000 remdesivir vials donated by USAID. He added that various pharma companies are not providing centrally allocated remdesivir vials to the state. He urged the central government to ensure complete and timely supply of remdesivir allocated to Maharashtra. He also requested to provide sufficient doses of Covaxin to vaccinate eligible beneficiaries aged 45 years and above. The Madhya Pradesh government is launching a new scheme to provide free treatment to poor COVID patients. Chief Minister Shivraj Singh Chauhan has said that under the scheme, the poor and common people of the state, including even the middle class, will be able to get free treatment for COVID-19 in the contracted private hospitals. More from our Bhopal correspondent.
The government will impanel private hospitals for treatment of COVID. Tests like CT scan, medicines, injections, oxygen, etc. shall be made available free of cost. So far, 2.42 lakh cards have been made under the Ayushman Bharat Yojana in the state, under which 88% of the population has been covered. All of them will be able to get free treatment of corona in government contracted hospitals. District collectors have been empowered to temporarily impanel private hospitals of their district under Ayushman Bharat Yojana. The government has increased the rates of Ayushman Bharat package by 40%. The state government will give rupees 5,000 as diagnostic advance to every person who is receiving treatment under the scheme. Pooja P. Vardhan, AIR News, Bhopal.
Karnataka's active caseload breached the 5 lakh mark with 49,058 fresh cases of COVID-19 yesterday, while the death toll stood at 17,212 with 328 deaths. There are 5,17,075 active cases in the state, with 18,943 discharges yesterday. 12,55,797 people have been discharged so far. Chief Minister B.S. Yediyurappa has said further stringent measures will be taken if the surge in cases continues. He also held consultations with a few cabinet ministers on the COVID-19 containment measures today. Deputy Chief Minister Dr. C.N. Ashwath Narayana has informed that 7,000 medical students studying various courses in the state will provide teleconsultancy services to those in home isolation. More from our correspondent.
Those tested positive for COVID-19 but are asymptomatic and in home isolation will have the benefit of interacting with medical students on all aspects of COVID protocol. Minister Dr. Ashwath Narayana, who heads the state COVID task force, has informed that 7,000 medical students are trained to provide telemedicine services and 700 among them are already working. On the shortage of hospital beds faced in Bengaluru, the minister has said that he has directed officials to shift patients to step-down hospitals after 5 days of treatment, saying that additional beds are being created. He added that hospital beds should be for those who are critical. Sudhindra, AIR News, Bengaluru.
In Kerala, a complete lockdown will be imposed from tomorrow till the 16th of this month. However, Chief Minister Pinarayi Vijayan has assured that essential services will not be disrupted during the lockdown. The state government had released elaborate guidelines regarding the statewide lockdown yesterday. State and central government offices, excluding those under essential services, will remain closed from tomorrow. Weddings which have already been scheduled can be solemnized. However, prior to the function, registration should be done in the COVID Jagrita portal and the nearest police station should be informed. Only 20 people are allowed to take part and COVID guidelines should be strictly followed. In funeral rites and ceremonies, only 20 people are allowed. Hospitals and related institutions in the health sector are permitted to function. Farming, horticulture, fisheries and animal husbandry activities are also allowed. Ration and grocery shops, fruit and vegetable shops are allowed to function. No shop will be allowed to remain open beyond 7:30 p.m. Banks, insurance and financial services will operate from 10 a.m. till 1 p.m. Press and media related activities have not been curbed. Water transport and metros will not be operated during lockdown. Distribution of goods and services will continue.
In Odisha, COVID-19 infection touched a new high as 12,238 people were tested positive today. With this, the total active caseload of the state has further risen to 86,950. However, 6,854 patients have also been cured from the infection today.
Even as the state enters the third day of the statewide lockdown today, COVID-19 scaled a record high by infecting more than 12,000 people in a single day yesterday. Leaving aside 4 districts which have reported new cases in double digits today, the rest 26 districts have been battling with the virus that has spiraled to 3 digits for each of them, the highest being 2,073 from Sundargarh. The virus also claimed a record 19 precious lives during the last 24 hours. Meanwhile, Union Minister Dharmendra Pradhan has virtually inaugurated 100-bed ICU with ventilators at a private hospital in Bargarh in western Odisha today. Girish Chandradas, AIR News, Bhubaneswar.
In Bihar, the National Highways Authority of India, NHAI, will set up oxygen plants in 15 districts of the state to meet the demand of medical oxygen. These plants will be set up under PM CARES Fund. The capacity of each plant will be minimum 960 litres per minute. 111 cylinders will be filled up with 1 kiloliter liquid oxygen. Under the scheme, oxygen will be made available to different hospitals through pipeline. Oxygen generation plants will be set up in identified districts of the state. These districts are Patna, Begusarai, Madhubani, Bhagalpur, Bhojpur, Navada, Siwan, Araria, West Champaran, Purnia, Saharsa, Samastipur, Vaishali, Rohtash and Buxar. The number of fresh cases of COVID-19 continues to rise rapidly. A record number of 15,126 cases were reported yesterday. The number of casualties due to the disease has gone up to 3,077. The positivity rate has gone up to about 16%. Patna reported 3,665 positive cases, the highest in the state, followed by 736 in Muzaffarpur district.
The Delhi government has directed hospital heads of all healthcare facilities under its purview, along with all private hospitals, to ensure timely updation of COVID bed status at their respective facilities. In an official order, the government of the National Capital Territory has asked the hospitals to update the bed occupancy and availability status as frequently as possible, but not later than every 2 hours. The decision is seen as a significant step towards preventing hardships faced by the public regarding availability of beds. The Delhi government has mandated a compulsory institutional quarantine of 14 days for people coming into the national capital from Andhra Pradesh or Telangana. In the latest order issued by the Delhi Disaster Management Authority, DDMA, it has been stated that people coming to Delhi by bus, train, flight, car, truck or any mode of transportation will have to mandatorily undergo 14 days of quarantine at an institutional or paid facility as a precaution. It said the decision has been taken as a precautionary step against a new virulent strain of COVID-19 that has reportedly been found in these states. DDMA has, however, informed that those people who have been completely vaccinated with both doses can show their certificate and will be allowed to be in home quarantine for 7 days on entering Delhi. It added the same rule of 7-day quarantine applies for people who can show a negative RT-PCR report which is not older than 72 hours prior to the journey.
The Haryana Police has come up with COVID-19 Hospital Transport Service, Cove Hots, for free transportation of needy infected patients from their homes to hospitals or nursing homes and back. The service is free and exclusively meant for COVID patients. Haryana DG of Police Manoj Yadav said that a total of 440 vehicles are being provided for the service and every police district would get 20 SUVs for this purpose. Prime Minister Narendra Modi has expressed condolences over the passing away of senior journalist Shesh Narayan Singh. In a tweet, Prime Minister said he will always be known for his significant contribution to the journalism world. Information and Broadcasting Minister Prakash Javadekar has expressed condolences over the demise of veteran journalist Shesh Narayan Singh.
The Tamil Nadu cabinet, led by Chief Minister M.K. Stalin, was sworn in today. The State Governor Banwari Lal Purohit administered the oath of office and secrecy to Stalin and his 33 other cabinet colleagues at a function held at the Raj Bhavan lawns in Chennai this morning. He later took charge in his office at the Secretariat at Fort St. George in Chennai and signed in 5 different files. Our correspondent says the clearance of the files paves the way for fulfilling 5 of the key promises made in the DMK party election manifesto. More from our correspondent.
Chief Minister M.K. Stalin signed the files to provide 4,000 rupees each to the families of the rice ration card holders as the COVID relief, out of which 2,000 rupees each will be disbursed this month itself. Expenses for COVID treatment in private hospitals will be paid by the state government itself under the state's insurance scheme. Another file is to permit women passengers to travel freely in town buses. Milk prices of the state-run Ovin outlets will be slashed by 3 rupees per litre. A new department is to be formed to resolve the issues being faced by the public in 100 days since the submission of their requests. The Chief Minister has a series of official engagements this afternoon. He is expected to interact with the district collectors on virtual mode. It is for reviewing the measures being taken to contain the pandemic. Mr. Stalin is also expected to have his maiden cabinet meeting in which he would outline the priorities of his government, besides taking key decisions. Jai Singh, AR News, Chennai.
Prime Minister Narendra Modi has congratulated DMK Party President M.K. Stalin on being sworn in as the Chief Minister of Tamil Nadu.
In Puducherry, Mr. N. Rangaswamy was sworn in as the Chief Minister by the Lieutenant Governor of Puducherry, Dr. Tamilisai Soundararajan today. He is the 20th Chief Minister of the Union Territory. However, the ministers were not sworn in today. More reports from our Puducherry correspondent.
Puducherry NR Congress President N. Rangaswamy was sworn in as the 20th Chief Minister of the Union Territory of Puducherry at a simple function held in Rajnivas today afternoon. Lieutenant Governor Dr. Tamilisai Soundararajan administered him the oath of office and secrecy. However, his cabinet ministers were not sworn in today. This is the fourth time Mr. Rangaswamy is becoming the Chief Minister of the Union Territory. Due to COVID-19 pandemic, limited number of guests were alone invited for the swearing-in ceremony. It was initially planned to be held at Gandhi Square near the Gandhi statue in the beach road. However, the venue was later shifted to Rajnivas. Chidambaranathan, AR News, Puducherry.
Border Roads Organization BRO is celebrating its 61st Raising Day today. BRO is a leading road construction agency under the Ministry of Defence with a primary role of providing road connectivity in the border areas. It executes road construction and maintenance works along the northern and western frontiers primarily to meet the strategic requirements of the Army and is responsible for over 60,000 kilometers of roads. The BRO has also constructed roads in friendly foreign countries like Bhutan, Myanmar, Afghanistan, etc., thus contributing towards our strategic objectives in the region. Director General BRO Lieutenant General Rajiv Chaudhary conveyed his greetings to all veterans and BRO personnel on the occasion and called upon all ranks of the organization to continue on the path of excellence with renewed vigor and dedication.
Border Roads Organization, since its raising in 1960, has been committed to the nation building and disaster mitigation, putting India on a path of progress and development. BRO is playing a significant role in our collective vision of Atma Nirbhar Bharat by connecting the far-flung places with the mainstream of India. As a strategic national asset and a premier construction agency, the organization has constantly played a pivotal role by undertaking infrastructure development in 11 states and 3 union territories. We are also actively involved in road construction projects in India's friendly neighboring countries and preparing to expand our reach outside India.
Now let us take a look at the weather report and forecast for today. The national capital Delhi is having a partly cloudy sky. The maximum temperature will be around 38 degrees Celsius. The minimum was 22 degrees. Mumbai with partly cloudy sky will see a maximum temperature of around 35 degrees, rising from a lower level of 27 degrees. Kolkata is having a partly cloudy sky with possibility of moderate rain or thunderstorm. Srinagar is seeing thunderstorm and rain. The temperature will hover between 11 and 23 degrees. Jammu is having partly cloudy sky becoming generally cloudy towards evening or night. Leh is seeing generally cloudy sky with light rain or drizzle. Upper limit of temperature will be around 19, rising from minimum of 6 degrees. Gilgit is having generally cloudy sky with possibility of rain or thunderstorm or dust storm. Muzaffarabad, the sky is mostly cloudy. And now before we end the bulletin, the headlines once again. Centre exempts persons with disabilities and pregnant women employees from attending office till 31st May. Complete lockdown imposed in Rajasthan for 2 weeks to check the rising cases of COVID-19. Madhya Pradesh government to provide free treatment to poor COVID-19 patients. NHAI to set up oxygen plants in 15 districts of Bihar to meet the demand for medical oxygen in the state. More than 16 crore 49 lakh COVID-19 vaccines administered to people in the country so far. Over 3,31,000 people recover from COVID-19 in last 24 hours. 4,14,000 fresh cases of COVID-19 registered in the country. M.K. Stalin sworn in as the Chief Minister of Tamil Nadu. N. Rangaswamy sworn in as the Chief Minister of Puducherry. And Border Roads Organization celebrates 61st Raising Day today. For details of these stories and more, log on to our website www.newsonair.com and News on AIR app. And with that, we end the Midday News.